Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetzelaar, Editor-in-Chief of the journal. And with me today, I have McKenna Voorhees, who is a doctoral graduate in Nutrition and Food Sciences in the Department of Nutrition, Dietetics, and Food Sciences at Utah State University. Her dissertation work centered on interprofessional teamwork in dietetics, as well as food insecurity. Today, we'll be focusing on her article that is titled Registered Dietitian Nutritionists' Attitudes of Interprofessional Healthcare Teams, a Cross-Sectional Study. Welcome, McKenna.
Thank you for having me. I'm so happy to be here.
So I want to start with the fact that your study involved a cross-sectional survey. And I wondered if you might please explain how the survey was developed, how you collected the data for the study additionally.
Absolutely. So for starters, interprofessional teams are becoming emphasized more and more to help support health outcomes for patients or clients. And of course, we know that dietitians play a vital role in various health conditions. But despite this, dietitians are generally understudied in this area. Because we know that there is value in examining attitudes due to that relationship with behavior, we wanted to examine how dietitians in the U.S. from different backgrounds, locations, specialties, genders feel about interprofessional collaboration. So with that in mind, we developed a survey. It was an online anonymous survey that included different demographic related questions, like some of those things that were mentioned before, locations, specialties, and other questions as well that we hypothesized to be important in relation to interprofessional attitudes. And to actually measure attitudes, we utilized a measure called the Attitudes Toward Interdisciplinary Healthcare Team Scale. And this measure is concise. It includes terminology that's applicable to a variety of specialties and professions. And it includes two domains. The first is attitudes about efficiency of team-based care and attitudes about the service quality of team-based care. That's kind of the basis of the survey. And in terms of collecting our data, we obtained the contact information of about 5,000 dietitians from the General Registry of the Commission on Dietetic Registration, but we also reached out to nutrition managers of major healthcare facilities to ensure that we had sufficient clinical representation. It's sort of beyond this particular research paper, but the survey did include questions specific to dietitians that specialize in clinical practice.
Then I wondered too if you would explain your term interprofessional healthcare teams and then tell us a little bit about what that means in this particular study.
Sure. So we used a few terms interchangeably throughout the paper, including interprofessional healthcare teams, interprofessional collaboration, and team-based care. And those terms refer to when at least two professions, by professions we mean dietetics, psychology, medicine, occupational therapy, etc., are working, so when at least two professions are working together towards a common goal to help better meet the needs of a patient. Oftentimes, interprofessional teamwork or collaboration is discussed in regard to clinical care, which of course it is very important in this area, but a point that we try to demonstrate in the paper is that it shouldn't be isolated to this area of practice. For example, a dietitian specializing in sports nutrition may need to work collaboratively with a physical therapist to meet the needs of a recovering athlete.
Okay, thank you.
Sure.
What did your final results show relative to the registered dietitian nutritionists' attitudes of teams?
Yeah, so overall, it was encouraging to see that dietitians perceive team-based care favorably. And just as a reminder of what the attitudes toward interdisciplinary team-based care scale encompasses was attitudes toward efficiency of team-based care and attitudes toward service quality of team-based care. And with regard to both of those domains, we found for efficiency first, that clinical dietitians held more enthusiastic attitudes about the efficiency of team-based care when compared to sports dietitians and dietitians specializing in food service or food service management. And we also found that dietitians who felt more valued by other team members had higher regard for both domains. So what do these mean? What can we draw from these findings? I think first, perhaps we could place greater focus on interprofessional collaborative practice in specialty areas outside of clinical nutrition. This could occur at the education level prior to professions receiving their licenses through interprofessional education. Also at the professional level, this could occur as well. Another consideration is, perhaps there are some structural issues that might exist in other areas of specialty that inhibit the efficiency of team-based care. So, for example, clinical dietitians may be working within the same building as the professionals that they're working with, whereas other specialties may not have that accessible to them. And then also, it's important for the dietitian to feel valued, and these results suggest that there could be, possible implications on team dynamics or participation on teams, and perhaps we should be emphasizing appreciation and value for the dietitian more.
In regard to your study, what 3 things should a reader keep in mind after reading your article?
So first and foremost, I think the most important thing is that interprofessional collaboration matters, and dietitians are valuable and important members of these teams in helping to support patient or client care. Second, how valued the dietitian feels matters, and it could potentially impact, team dynamics as well. And I think lastly, consideration or future direction. Just like any study, there were some limitations to this study. In particular, there was a pretty significant imbalance of gender, and other research has shown some mixed results in terms of how gender is related to attitudes of team-based care. So unfortunately, because of that limited diversity of gender we had in our study, we weren't able to explore this topic in detail, but it remains an important topic and a gap that we hope future research can examine further.
How might the practicing RDN use your study results in a work setting?
So I think the finding about the importance of how valued the dietitian feels by other team members is something useful for clinical dietitians as well as dietitians from other specialties. So to help foster this appreciation of the dietitian, I think things could be implemented at the education level in the form of interprofessional education where various disciplines are learning about, with, and from one another. But this question was about how the practicing dietitian in a clinical care setting could utilize this information. So some ideas that come to mind, I think first, practicing at the top of our scope whenever possible. Requesting to support or take on responsibilities that are within our scope but might be completed by other providers. For example, if another provider is taking the lead on total parenteral nutrition recommendations or tube feeding recommendations, volunteering to help provide recommendations in those areas. Another is speaking up in team meetings, asking questions, providing insights. If team meetings aren't currently occurring, considering suggesting to have them. And then I think one that goes a long way is getting to know other professions formally and informally, and also mentoring emerging dietitians, helping them learn about other profession scopes, and in turn, enabling other health profession students to learn from us.
Great. I think that combination of working together and then making sure that maybe in the mentoring process and the learning process, our DNs are also exposed to working with other professions, which you have indicated in your research. All of those great ideas in terms of what the practicing RDN might be doing early on, for sure. And I want to thank you for your comments, because I do believe that for the Academy membership, much of what you've learned can be used in a variety of settings for members of the Academy. And I think your research brings a novel and very interesting piece to what we may have thought, or what we may have assumed in the past. And so thank you so much for being with me today and responding to my questions. I appreciate your time.
Absolutely. Thank you.